When you hear someone saying they have a touch of diabetes or their sugar level is not so high, in most cases, they are not taking the disease seriously. And because we do not know the information, we lack the information, we're not in a position to tell them, well, you need to see a doctor or you need to take your meds. I'm going to tell you in this video some relevant information that you can use for yourself as well as others. Remember, awareness saves lives and prevention is better than cure. Hey, it's me again. It's Alicia Davis from Fitness and Diabetic Health. And without further ado, we're going to jump straight into it. But first, I encourage you to watch this video to the end because you will get some very fruitful information. It's very informative. And as I said, you can use it for yourself as well as your loved one. According to the statistics reported by the Centers of Disease Control and Prevention, CDC, in the US for 2020, persons living with diabetes is now at 36 million, and persons that have been diagnosed for 2020 is 24 million. So you see that it has been increasing. But what is really diabetes? Diabetes is the chronic disease where your sugar level is too high, and it has been, as I said before, affecting several persons. But we not knowing the information, we do not know what to do. What controls your sugar level is the insulin in the pancreas, which is an hormone. Sometimes that hormone is not working properly, it's not functioning properly, and insulin extracts glucose or sugar from the food that we eat, and normally those foods are carbohydrates. But what if the insulin is not working? We have problems there. There are several types of diabetes. You have pre-diabetes, you have type 1 diabetes, type 2 diabetes, and lastly, gestational diabetes. Pre-diabetes is where your sugar level is high, it's relatively high, but it's not at a stage where your doctor will diagnose you as being diabetic. So therefore, you have to control it before it actually reaches that stage. Type 1 diabetes is where your sugar level is relatively high or it can be low because the insulin in your body, the body is not making insulin. So type 1 is where your body is not making insulin at all. And remember, insulin extracts the sugar from the food we eat. So if it's not working or it's not performing as it should, there is problem there. Type 2, the body is not making or producing or using insulin properly. And with this diabetes, at this stage, your doctor will prescribe medication or they will give you insulin. And for gestational diabetes, that's where that occurs during pregnancy. So a lot of us who have children, we are aware of this one because we have to actually take glucose tests. And with this diabetes, if you should have it, it normally goes away after giving birth. But what are the symptoms of diabetes? Because we have to know some of the symptoms so we can be aware just in case. Symptom 1, if you're peeing a lot, more than usual, you see that you're going to the bathroom regularly, that can be a sign of it. If you're tired, you're not doing anything strenuous, you're not doing any exercises, you're not working hard, and you realize your body is shutting down, you get really tired, that's another cause or another symptoms of diabetes. If you realize you're thirstier than normal, sometimes yes, we're thirsty, but you know when your body is not, you're not supposed to be thirsty. You're just every minute you're thirsty. It's so regularly, you must see that there is a problem. And if you realize that your appetite has increased, it changed, you're eating more than usual, that's also another symptom of diabetes. And how about your vision? If you're not seeing properly, your vision is blurry, check your doctor. If you're having these symptoms, I would advise you to visit your doctor, explain to them the symptoms you're having so they can check your blood pressure, they can also check to see whether or not you're diabetic. So those are the symptoms that we're supposed to be looking out for. But what really causes diabetes? If you are overweight, if you have extra pounds in the belly section, that can be a cause of diabetes, or that can lead to diabetes. If your waistline is more than 40 inches in men and 35 inches in women, that's also a cause. So if you're overweight, your waistline is getting fuller or bigger, that can be a reason. If you're eating red meat or processed foods, that can also lead to belly fat as well as diabetes. And I provide a link that you can use how to lose belly fat. Red meat and processed foods, they have a lot of other ingredients. They use a lot of other ingredients to preserve these foods. And what the body does with these ingredients, they store it because the body treats it as toxic. And what it does with toxic, it stores a toxin in our fat cells. And that will cause our waistline to get bigger. So try and avoid processed foods. If you're not eating healthy, you're drinking sugary juices, you're eating saturated fats, all of those can lead to being overweight, belly fat, and eventually will cause diabetes. How can we prevent it? I'm sure a lot of us are watching this video. We do not have it, but we want to know how to prevent it. And for all my viewers who are watching and want to control it, I know you need the information and I'm about to give it to you. How can you prevent it / control it? 1, exercise. Exercise is so important. Keep your body moving. Try and reduce, once you're exercising, you will lose the weight. And try and reduce your body fat by 5 to 10% of your weight. That's one reason. And how about walking? Walking 3 times a day, twice per week. And gradually you will change. You will want to do other exercises. And of course, I always say this, do activities that you love. Eventually you can move on to weight training because of course that burns more calories. Eat healthier. Do your meal prepping. That helps you to plan in advance. That helps you to choose healthier meals. When you're going to the supermarket, have your list. Choose vegetables. Eat more vegetables. Eat more fruits. Those have lower calories as opposed to the processed foods. Those are easily digested rather than the processed foods. Processed foods, there are times when they're in your system for so long. So eat healthier, exercise. If you have meds, those are the ones who want to control it and the doctor gave you your meds, take your medication. It's very important they gave you that medication to either stabilize it or to bring it down. So take your meds. Drink more water. Add more water to your diet. Water hydrates the body, it increases your metabolic rate, and of course it reduces calories. And if you're drinking more water, it's more than likely you will drink less of the sugary drinks. So drink more water. Add more water to your diet. I can never say that enough. If you are experiencing these symptoms, get your blood pressure tested. Let them tell you that everything is normal. So these are the ways of controlling it and preventing it. If you found this video helpful, share it, comment, and subscribe, because I'll be doing other videos and I do not want you to miss them. I'll be doing videos to help you throughout your weight loss journey, as well as to give you information on diabetes. So thank you for watching, and remember to share, like, and subscribe. Have yourself an excellent day.